Hi, my name is Dr. Paul Martis, and I'm a family physician working in Olathe. My clinic is at Hedge Lane, right between Kitty College and Olathe West High School. I do see a fair amount of pediatrics coming through the practice, and I thought it would be a good opportunity to talk about certain things going on in our community with respect to the stress and anxiety with re-socialization, and how do we get back after months of quarantining and basically isolation. There's a couple of questions that have been posed to me, so I thought I'd just answer them and go through them one by one. The first question is, how do we help kids transition back into socialization after telling them for months that they need to be apart from others? So this is a tough one because ever since March, we've been quarantined, self-isolation, and then as everything kind of opened up again, we kind of had new rules in place to get back to what we consider our new normal. Now with kids, it's important to let them know the reason why we wear a mask and why we have to social distance. The risk of exposure and the risk of transmission of the virus is important and helps them understand, hey, keep the masks on so then at least they can continue to go to school. The one thing I've noticed is that both parents and kids coming through my practice, they have all sorts of cool masks and cool designs. So that's a good talking point for kids when they see their friends with all these different masks to talk about it and maybe even match outfits. It's one of those things where we kind of look at the light behind whatever's going on with this pandemic and kind of help our kids stay more engaged with their reality. The other thing is the masks are meant there to protect them and protect their friends. So keeping it on is important. Making sure not to touch each other, hug each other when they see each other. It will be a challenge, especially with younger kids. But as long as you remain dedicated to communicating with our kids, I think it'll help them understand what they need to do. The second thing is, how do we ease the kids' fears from getting sick? The main thing is be honest. Tell them that the masks are there to protect them. Make sure they engage in proper hygiene. Make sure they don't touch their face if they don't need to. And basically have open communication and dialogue. This should be a continual basis. Talk to them every single day. They come from school, ask them how their day was. Make sure they understand that, although we are living in a pandemic, there's certain things we're doing to kind of help protect ourselves. And even if the kid does get sick, there's no shame or guilt associated with that, and it's not their fault, even though they did everything correct, like wearing a mask or doing the proper hygiene. Older kids, maybe sharing some statistics with the coronavirus might be helpful for them so they can understand what's going on and help remain engaged through this whole process of getting through this pandemic. The last thing is for the parents to kind of help them navigate through some of the stress involved with the exposure. This one you have to, the first thing is do not panic. Assess the risk of exposure, who was exposed, which loved one. If your kid was exposed, get a little bit more information on the severity of symptoms of the person who was exposed to. And then if the symptoms are severe enough, definitely please call your primary care provider and see whether you need to be seen or tested. That's the main goal. So then you can at least quarantine, stay at home, keep everybody safe. Part of quarantine too, after being exposed, is to stay home with the family and kind of reassess and make sure everything is right. The thing is, it cannot be avoided being exposed. I mean, this virus is there no matter what we do in terms of our masks and protection and hygiene, but we remain vigilant, continue doing what we're supposed to be doing. The other thing I tell parents and kids is you have to improve your immune system. So proper nutrition is important, sleep, rest, so that way your immune system can fight and have a chance if there is exposure. We're seeing a lot of cases where patients are asymptomatic or have mild symptoms, and so that's a testament to the immune system to kind of fight it off if they can. This is a pandemic, and I know we'll all get through this together. I'm a parent myself, and so I regularly engage with my kids to kind of help them out through this whole process and remain honest, and that's what we have to do. I know we'll get through the pandemic, and I hope everyone remains safe. Thank you for your time.